Hello, everyone. Welcome to Connecting the Dots with Dr. Ashaye. I'm so excited to be here once again. It's always a privilege to come back and, just talk and discuss different, very important health topics. And this is the place to be if you desire to take charge of your health or if you want to make sure you're doing all you can to live a healthy lifestyle. Remember, you can listen to this episode and all our other episodes on our InTouch Primary Care YouTube channel. Remember to leave comments, subscribe, and share. So today I have a very special guest, Dr. Isabelle Amigues. Did I say that right?
Yes.
Yay! So Dr. Amigues is a rheumatologist, and after a powerful life-altering experience, she has learned how to incorporate alternative approaches to the management of medical conditions. And today we're going to be talking about a holistic approach to arthritis. So I am so excited to have you here.
Thank you so much for having me. It's a pleasure. I'm very excited about this opportunity.
Awesome. So can you tell our audience a little bit more about yourself personally and professionally?
Yeah, absolutely. So first of all, I'm a rheumatologist and I absolutely love what I do. So much so that I did it in France and then I came back, I came to the US and I did it all again in the US. So I have many years of training, but it was such a pleasure. Who's counting, right? When you love. And the reason I came into holistic practice, I think I was starting to shift already before my 40th birthday, but as you mentioned, a life experience, experience really changed my practice. So at 40 years and 2 weeks, I got diagnosed with stage 4 cancer, and it was a very, just before the diagnosis, it was very stressful time in my life for no particular reason. Some may have called it, maybe I was burnt out. I don't know. I just didn't feel that I was where I wanted to be. And interestingly, when the diagnosis of cancer was made, because the cancer probably came before, but when the diagnosis of the cancer was made, I was very open to holistic practice. So energy medicine, in addition to the Western medicine, which is so powerful. And because I had stage 4, I basically was extremely open to what we call the power of placebo. But then the question is, how do you use placebo if you're a physician, right? Like, you know the medication, so you know when something is placebo. And so, in rheumatology particularly, there's at least 30% of placebo effect. So placebo, just so that everyone is on the same page, it's when you give something, like it can be sugar, it can be anything, and it looks the same, it is the same, or it's like through the vein, or it looks exactly the same, except that it doesn't have this active ingredients. And so that's what you call it placebo, because it pleases and it's going to make you be like, have good effect. And so I was looking for this placebo effect to be on my side, since I had the stage 4 cancer and it was scary. And I started just reading a lot about meditation, about visualization, affirmations, and so on, and started going very deep into myself. And I will say that it was life-altering, because it not only helped me through the cancer, it really changed my practice of medicine completely. So instead of fighting disease, I'm trying to understand what's going on, go very deep with the patient, understand what's holding them back, and then we move on from there. And it's a much broader approach to what's going on in our body. But basically, that is my story in a nutshell.
Yeah, so such a powerful story. I mean, you experienced it personally, and so you can bring that personal experience with your experience of being a doctor twice. I don't know. Doing that whole training twice, I really applaud you. That's tough. And then you were able to bring that to patients and practice holistically in many different conditions. It can be applied to many different conditions.
Mm-hmm.
So that's awesome. So can you tell us, like, we're talking about arthritis today. What are the top 3 challenges that people face when it comes to arthritis, in your view?
Oh, there's more than 3.
Oh.
But I would say there is 3 that I can think of. If you have an inflammatory arthritis, and we can define that after, inflammatory arthritis, there is a shortage of rheumatologists nowadays. And so patients may wait a very long time to be seen. And that's a big issue because the earlier you take care of the inflammatory arthritis, the faster you can get that arthritis into remission and the better outcome you get. So outcome is, it's not just the pain. The pain is going to go away, the swelling is going to go away, and you also are not at risk as much to develop erosion and deformity. So I would say that access to rheumatologists is key. That's like number 1 problem nowadays.
Mm-hmm.
There are some people that wait 6 months, 8 months to be seen. The second one is to know when to call their doctor or when to ask for advice. This is particularly important because, as you know, when we age or if we use a lot our joints, you can have what we call wear and tear, and it's osteoarthritis. We are learning more and more that it might not just be wear and tear, that there's at least a little bit degree of inflammation of some sort, and it's genetic and so on. And when do you decide to contact your primary care physician or your specialist and say, hey, I have joint pain, can you help me? Or, just be like, okay, that's okay, I'm going to live with it. I'm going to just try to take some anti-inflammatory or some pain medication. So when do you talk to your physician? And I would argue, talk anytime. At the moment you have joint pain, it's better to talk to your physician, and we can discuss then what's, if this needs further in workup or not. And the third one is, well, so this is from my own patients, the one that I see very often that they may have been I don't know if you use that word, gaslighted or gaslit, but basically that the medical community, and there's a lot of burnout right now in the medical community, and I would love to hear what you've done to prevent that. But there's a lot of burnout because there's more and more demand of physician, and they are coming from everywhere. And at the same time, there's less and less doctors that can see the patients. And because of that, sometimes there's burnout. I mean, that's why how I explained that some patients may have been told it's nothing, like there's nothing that I can do. And so they are basically being dismissed. Those are the third, like 1, 2, 3 that I consider the most difficult for patients at this time. Yeah.
Yeah, no, I definitely agree. Access definitely in many fields of medicine, especially with specialists like rheumatologists. I think that's huge. And then not knowing, the different types of arthritis. They may not know when it's just joint pain or that, they sprained something versus something that is starting to develop. And then, the fact that they can't get personalized, attentive care. And where they feel like they're being dismissed. So those are very important. I think that. So actually, I'm going to ask a question from a specialist perspective, right? What can a primary care doctor like me do while they're waiting? Like, say we've determined they need to see a rheumatologist, but it's going to be 8 months. What would you say will be a helpful thing that I can do while they wait so that they don't develop erosion and things are not reversible?
That's a really good question. So number one, I'm just educating here your patients because I think that's really important. And number one, I think is to know when a pain is inflammatory. So and that's what I do with every single patient. So you look at, is the pain worse in the morning? Is it associated with morning stiffness? So you're like, I need to do this in the morning for more than 30 minutes, or like move my back and for more than 30 minutes. And is the pain improved with exercise? All right, that is what we call an inflammatory arthritis. If it's mechanical, it's going to be towards, like, it's going to be worse at the end of the day. And when you're doing something with the joint. So for example, I rock climb. So like if I rock climb, I have more pain in my hand, so I know where it's coming from. And I'm just like, okay, that's part of the game. But so worse at the end of the day when you're exercising, there is no morning stiffness. And if there is stiffness, it's like literally 5 minutes. It can go up to 30 minutes, but most of the time it has to be less than 30 minutes to consider that this is mechanical. Well, I think I said at the end of the day, and it's worse with exercise. So when you determine if the pain is inflammatory, worse in the morning, there's morning stiffness of more than 30 minutes, and there's swelling of the joints. If you have this, I would argue that you could start the patient on some anti-inflammatory, so NSAID, and probably the patient has already started. And then you can actually try to push to get an appointment. If you don't have, if you can't find someone to get to see the patient within, I would argue within 2 weeks, honestly, then I think it might be useful to start a medication. So you can, depending on your level of confidence and how you feel comfortable with it or not, you could start methotrexate, because literally every inflammatory arthritis will get better with methotrexate. And at the same time, you also, of course, double check what they have. So, you know, you're checking a rheumatoid factor, a CCP, you're checking that they don't have gout, because methotrexate will not help for gout, and so on. And basically, you do a workup, and that includes, I would say, really like CCP, rheumatoid factor, uric acid, and if they have a swollen joint, getting some of the fluid out to see if they have some sort of a crystal in it. If you do this, you already do quite a bit of the rheumatologist's job. And then you can move on to treatment, which is, you know, methotrexate or Plaquenil. Plaquenil is super well tolerated. There's hardly any side effect. And if you start Plaquenil and the rheumatologist can only see the patients in 4 months, that's okay. There's not really anything that you have to follow with Plaquenil. Whereas methotrexate, you would have to follow the blood work. But so I would say, depending on the level of confidence, you can start, you know, NSAID, then Plaquenil, then methotrexate. But of course, the ideal situation is you have a rheumatologist on hand with whom you have a very good relationship, and you get to they get to see your patient. But so that's really what's important. I would say you want to push if there is inflammatory arthritis.
Right.
The patient is probably going to have a lot more pain, in fact, than the other type of patients.
Exactly. Yeah. No, thank you. That's really, really helpful. I think you touched on a lot of things that will help just, you know, patients and primary care doctors to, you know, advocate for patients too when they have, you know, inflammatory arthritis. Awesome. So what are some of the common conditions you treat in your patient population, and like how do you combine holistic and traditional medicine?
That's a really, really, well, you know, I light up because I love it so much. First of all, my specialty is the best specialty in the whole world. And there's a reason for that. One, we create connections with our patients. So like you, I get to see my patients on a regular basis, and I absolutely love it. But I would say there's 3 types of patients. There is the doctor house type of patients, right? So you do not know what the patient has, or they have something very inflammatory and you're figuring out what's going on, okay? So that's 1/3 of the practice, maybe a little bit less, but so I'm going to include with them the severe cases of vasculitis, so inflammation of the vessel. So, you know, like fevers, like very severe, and you have to do something pretty fast. Those patients can end up in the hospital. So usually we get them from out, you know, discharged from the hospital, or if they have a very good primary care physician, we usually get a phone call and we get them in pretty fast, okay? And then the second type of patients are the chronic inflammatory patients. So it's going to be gout. So we see gout that is difficult to treat by primary care physician. So that's definitely one. We see inflammatory arthritis, such as rheumatoid arthritis. We see Sjogren, which is dry eyes, dry mouth, and some joint pain, but it can, of course, not of course, but it can sometimes be associated with more disease, more organ involvement. We see lupus. Lupus is systemic, so it can affect like every single organ. And usually they have, sometimes they have joint pain, so they come like this to us. Some other time they come through, the pulmonary or through the cardiologist or through the nephrologist to us. So yeah, and then there is spondyloarthropathy, which is psoriatic arthritis, ankylosing spondylitis, and it's basically spondyloarthropathy is this very fancy name to say that you have a disorder of the spine, but it's a mouthful, spondyloarthropathy. So that's the second type of patient. And then the third type of patient is chronic pain, no matter where and what it is from. There's a lot of fibromyalgia, of course, but it can be pain. We don't know why. And they want to know what's going on and how can we help. So post-COVID, for example, there's a lot of patients with a ton of pain post-COVID. And so that's part of the practice. So the way I approach the holistic part is number one, if there is something urgent, you treat, right? We have nowadays in 2022, so many good medication. I mean, the reason I became a rheumatologist is because we had biologics that came on, and it changed the practice of rheumatology, the same way that immunotherapy is changing the face of cancer treatments. And so I love my treatments. But you don't necessarily only need the treatment. So sometimes you don't need the treatment, like the biologics and so on. Sometimes you do need it. And what I do is that I try to empower the patient in the sense of when I give a medicine, that's great. It's wonderful. The medicine is going to work. But in front of me, the patient has to buy into that medication in the sense of they have to be okay with starting this medication. And what I've seen sometimes, and some patients will have, side effect after side effect, and you're trying different stuff. And it's only after after an honest discussion with them of, what this, so for example, I'll just give you some example, but why is this, like what may have this condition brought to them, right? Is there anything good that this has brought to them? Or anything like this, right? So that in a way they can finally, and I'm not a psychologist for sure, but this is a very vulnerable moment where you're basically saying, hey, you trust me, I trust you, do the homework at home, you don't have to tell me, but is there any way that this is good for you in any part of your life? And what I've found is when you say this, when you ask this question, I mean, not all of my patients will come back and tell me, yeah, this, but there's a lot of patients that will be like, oh, you know what? I figured that out in my life, or I figured this thing, or, oh my gosh, I had never realized how much it brought to me, or my life changed, but not necessarily all bad. And in a way, I think that, and this would be very interesting to discuss with a psychologist, but my interpretation of this is that because they're able to let go and realize that, okay, this has brought me something, but I don't need to carry this and to have pain and not accept the medication to understand what this condition has taught me. So that's my approach, my holistic approach in terms of what I would call the mind and the spirit. And then I add also a lot of complementary approaches. So meditation decreases the inflammation. Diet, I mean, I don't like the word diet because it's like very restrictive. I use nutrition, but nutrition is very important. So you want to, have as many vegetables as possible that are greens. And, I think all of us actually know what's good and what's not. Most of us were told by our grandparents or grandmother what was good. And so I just feel like I look at something in my plate. I mean, usually it's not in my plate. So, and I'm like, yeah, I really like this, but it's not going to be good for me. So to change my nutrition, I really had to be like, okay, do I want, direct instant gratification, or do I want a little bit longer gratification? So really, because that's what it is, right? A burger gives me instant gratification, but very soon after, I don't feel great. So I said meditation, I said nutrition, exercise. Those are like free ones. There are more, of course, but free things that patients can do knowing that it will decrease the inflammation. And those free methods have been shown in inflammatory arthritis to work. So for example, the meditations decreases inflammatory marker. So that's fascinating. Like when I looked at the studies, I was fascinated by that. Exercise clearly improves the energy level. Again, that has been proven many times in the scientific world. And the diet, so sorry, the nutrition choices, same, it's been proven. And you know, what's super cool about medicine, one of the things, is that the patient is always right. They always come and they say, you know, so I remember 20 years ago, I had a patient tell me, you know, every time I eat this, I have more flares of rheumatoid arthritis. And at the time I was like, oh, and I was a student. So I wasn't, you know how you are as a student, you listen to everything black and white. And I was like, yeah, no, that's not possible. Diet doesn't have anything to do with your rheumatoid arthritis. All right. 30 years later, clearly there's a link. And you're like, I should have listened then. So, you know, it's fine. I listened. At the end of my medical school, I was already listening very hard and being like, okay, could there be something true here? So I had a friend who kept telling me that every time she had inflammation of her gums, she would get pain in her tendon. And I was super interested. I was like, that's very interesting because, you know, there is potentially a link. 10 years later, rheumatoid arthritis, we know that the IgA that's like in the mouth are related to rheumatoid arthritis. So everything has a link, and the patients are usually the first one to tell us what to look at. So I always tell them, listen to what your body has to say, because it's telling you something. So listen to it. And then teach your body to move a little bit more and to heal, you know. But we're here to help our patient's body. That's how I see it. And as a patient, I see it like this: like I'm helping my body. I'm coming from a place of not a place of upset. I don't want to be upset at my body. I think my body is trying its best. And whatever happens, I have to take the best of it, if that makes sense, you know.
Yeah.
That's a holistic. Sorry, it was a long explanation.
No, we got like very, very good tips. I hope you guys are listening. This is, you know, great information. Mindset is so important. It's important in, you know, we're taking it more seriously now, but it's always been important in many, many conditions. Nutrition, I mean, we know. We know that nutrition is so important. We're finding out it's even more important than we thought. Like it affects so many things. And it's the same things that keep coming up. Green leafy vegetables, you know, like for so many different conditions, be so helpful, including arthritis. So it's awesome to talk about. And exercise, even outside of nutrition, has many, many, many benefits. You feel better, more energy, decreased risks of anxiety and depression. I mean, there's so many things that exercise is good for. So in addition to, you know, helping with arthritis. So, and I'm going to steal what you said about listen to the body, and then think about instant gratification versus longer gratification. I think that's a great way to put it to people and to myself too. Like, you know,
Yes. Yeah, it's hard.
Enjoy now, enjoy long term. Yes.
Yeah, or midterm even. Yeah, for sure.
So those are really, really great tips. I really think we've learned a lot today. Okay, so tell me a little bit more about your practice now, like where you're located and how people can, you know, find you and all of that good stuff.
Yeah, absolutely. So currently I'm in Denver, Colorado, and I plan to stay because I love this state. It's beautiful. Come visit. And I am still at National Jewish, which is a wonderful institution. But I think, well, not that I think, I'm opening my practice next year, so in 2023. Yeah, and in fact, I want to open a practice that's like yours, direct care. And I would love to hear you explain what the benefit of this direct care is. I have the reason for me is that I want to have better access to good care to my patients. I think it's like it's so important to have a doctor that's not burned out and to have access to a doctor. And it feels to me that the practice of medicine, as we have entered, to do, like, meaning that when I became a doctor, I was imagining beautiful relationship with my patients, and that's why I'm a rheumatologist. And then more and more with the system, what I'm seeing is, the next patient I'm going to see, it's in 6 months. I have to overbook, and my institution is amazing. Yet I do feel that there is better to do access, like, to create an access. In the meantime, until I open this practice, I have a podcast and a website called Unabridged MD. So unabridged, non-edited, full version MD for medical doctor. And I would love for, I try to share some insight about just chronic condition and just life in general, I almost want to say, that are coming from my perspective as a physician and former stage 4 cancer patient. And usually I get some questions from the community, and so I answer that. There are usually very deep questions, like how to love yourself, how to have hope, how do you deal with fear? So there's a lot of those questions, and I try to answer them, as honestly as I can, and try to offer some insight. So that's
Wow. That's wonderful. Yeah. So we'll definitely have the links to, the podcast on our on the chat when we're done. We're also going to, make sure, I'm sure you're going to keep people up to date on there too. When you open, we're really excited and looking forward to it. So yeah. And we talked a little bit about the direct care model. And yes, I love talking to other doctors about it. I've been working to convert as many doctors as possible, because it's a great model. I mean, we talked about the barriers to access to care access to care being one of the major barriers for patients. And that's what direct care addresses, like head on, allowing, when people become members of the practice, they have access to as many visits as needed, as often as they need. They're not having to delay their care. Patients can see us same day, next business day. They have video, they have text, they have email, they can call. So many different ways where they can reach us directly, and they don't have to delay their care, which makes a huge difference long term. So they're basically incentivized to seek care, instead of how the system is right now. They are actually incentivized to delay care. So with the direct care, we're able to be so much more proactive, and that really helps to prevent serious conditions long term. So I love it. And
yeah. And I'm sure you have better connection even than we have with patients. I'm like, I cannot imagine this as a when I hear direct care physician like you, it feels like, oh wow, my love for medicine is back.
absolutely. Yep. I know who my patients are. Like, I actually know them, and I know them very well. It's like when I talk to patients now, it's almost like we're old friends, and we're just, we're talking, and we have a real relationship, and it's a much better model. Like you said, when we became doctors, we imagined certain things, and that was not happening. The traditional care model, and now it's happening. So it's really exciting.
No, that's great. Yeah. I mean, every single doctor that I discuss with that has this direct care model is like always,
You
they're
have
like light, and it's just like this beautiful smile of, oh man, I'm doing such a good job. It's not a job. This is a passion. I'm made
right,
for it.
right.
So I'm very excited. I'm very excited and nervous too, because I find it's both excited and nervous for sure.
Yeah.
It's wonderful. And I wonder, do you have example of why direct care is, like a tangible example of like, look, if this patient had not seen me, like it would definitely, that I know, for example, in Denver, if you want to see a primary care physician, it takes months. And if you want to see a doctor, it takes even longer. So most of the people that I refer to primary care physician at this point see advanced practitioners. And, the problem is that advanced practitioners have, I think, 3 to 5 years of training, maybe a little bit more, but definitely less than what we have as a physician. And it's a different specialty for sure, right? And so I wonder, do you have example where like, I know it's because of this type of care that I did a good job by this patient?
Yeah, absolutely. I mean, I can think of several patients, but I'll talk about a patient that is, he was a smoker. He had high blood pressure, high cholesterol, and pre-diabetes. So, and those tend to, come together. So the first thing we talked about, when I met him, like the best thing you can do for your health is quit smoking. And he was motivated too. And so, it requires more frequent visits. In the past, I'll just be like, you need to quit smoking. These are the things you can do. Let me know when you're ready. I'll see you back in 3 to 6 months. But now it was like I had time to really go over, the mindset, encourage him. We could talk, what are your barriers? What are your triggers? How can we prevent, get ready and plan ahead for those triggers? All those things we're able to talk about. And then I would send him texts, like I have text messages that I've prepared that I will send him from time to time to encourage him, all those things. And he quit smoking. It's been 2 months now. I actually remember when,
Wow.
It's been 2 months now. And the last visit, his cholesterol, he's only on 20 milligrams of atorvastatin, and his LDL was like 200. No, his total was 200. And his LDL, I can't remember what it was. Or maybe anyway, he dropped his LDL is 90 something.
That's impressive. That's so cool.
Because we've been talking about nutrition, and this is only, he's joined the practice in March. This is like 6 months. And he's quit smoking. His cholesterol is now controlled. His blood pressure is controlled. He's still taking medicines for that. But we've made like a real change in 6 months. Like this kind of person in a regular practice, it will take like 2-3 years.
Yeah. And if any, right? Because you lose the momentum.
Right.
So you see the patients at first, there's momentum, but you lose it so fast if you don't get to see the doc. Sure. This is so good.
Yeah, and then
everyone should work with you.
Phone visits, video visits, so it's flexible. So, you didn't have to keep coming in. Sometimes it'll just be a phone call. Sometimes it'll just be video, but that way we're encouraging and we're working towards a goal, and, it's so much better that way.
That's wonderful. So you see, in my ideal practice in rheumatology, I would see a patient and then 2 weeks later, I would, once we have all the blood work and the x-ray, I would, see them again and have a plan for them. And then we would see at 1 month and then at 3 months. And it's like very difficult to do this nowadays because it's, all of the spots are taken because there's so much demand. It's difficult. I can see how this is wonderful because you're finally offering proper care, like the best care.
Right.
Best care. That's great.
Well, this has been awesome. This has been so much fun. I think we we can keep going forever. But I think we'll go ahead and put your website information, social media handles. Can you tell us where we can follow you on social media?
Absolutely. So I have a Twitter account. I mean, everything has just started, but it's Twitter Unabridged MD, Instagram Unabridged MD, and a YouTube channel Unabridged MD, which is basically the podcast, but just with me. You can look at me versus just hear me on the podcast Unabridged MD. And if you want to support me, I would love, any, subscription because that actually shows that you're someone, and I hope I am someone. But that's the support that at this point people can give me.
Awesome. So you heard it. So you can support Dr. Amigues as she transitions on, and you go ahead and subscribe to the podcast. And you have been listening to Connecting the Dots with Dr. Ashaye. We are going to be having a webinar. I'm hosting a webinar this Friday, September 16th. It's on preventing serious health conditions. So if you're in the Houston area, we're going to put the link to that as well. You can go ahead and register for the webinar and look forward to seeing you. All right. Thank you, Dr. Amigues. It was a pleasure talking to you today, and
Same.
look forward
Thank
to
you.
listening to more of this. Okay.
Thank
Have a
you.
great day. Bye.